Hello. Thank you for clicking on this link. I'm Dan.Pfister, and this is Healthcare Stories. Man with the plan wins. If you've ever seen a really good surgical scrub tech, they can anticipate what the surgeon is going to need before he asks. And the surgeons know who the best scrubs are and request them. Certainly, experience, repetition brings that kind of skill. But the technician sets up the room prior to anticipate everything that will be needed. This preparation, getting ready, is simply called having a plan. Most of the time, a process improvement initiative comes up in hospitals because of an issue that arrives unexpectedly. Staff hustle to react and develop strategies to solve the problem. Invariably, this is going to cost money that has not been budgeted. Some years ago, I did a project in Southern California, supply optimization in a surgery department to address ongoing issues with product stockouts. This required inventory analytics to understand demand patterns and redesigning all the physical supply locations. They had high-density rolling racks in the center core that were old, rusted, difficult to move, even dangerous if people didn't look to make sure no one was in the aisles when they were rushing to get something. The analytics identified new par levels, high, low, and no-move items, and other opportunities to optimize the physical spaces. Visual management, co-location of items, but new racking would be integral to improving the process. However, it was outside of the capital equipment calendar, and even if that window were open, new racks probably would not have been approved over more obvious revenue-producing or patient care-related equipment. Lasers or surgical beds or laparoscopic towers would all get prioritization over supply racks. Making requests for money in a hospital requires the clinical side to explain or translate to the finance side the meaning of the financial request, the connection to patient care. The optimization plan had been reviewed and approved by the surgery staff and leadership, but it would ultimately come down to a money decision by the chief financial officer. I asked the director of surgery to invite the CFO to scrub up and walk through the center core. Typically, he was very busy, arrived 15 minutes late, and only had 15 minutes before he had to leave again. The CFO had not been inside the operating room for years. His walkthrough included quick discussions with nurses on their daily experiences with the physical space and getting caught himself in between the racks as a nurse was rushing to get supplies. The importance of the CFO's visit to the surgery department personalized the ask for the money, and it was approved without hesitation. It would have been impossible to connect the physical purchase of metal racking to patient care without seeing, touching, experiencing the environment. Most people are just working every day, keeping the lights on, dealing with the million things that need attention. And when a critical issue rolls in, the business unit, the team, the leader that has a track record of solution design, innovation, process improvement, and delivering on expectations gets the opportunity to develop the plan that will address the problem. The man with the plan wins because a good plan considers all the parts and pieces of the issue, the politics, the advocacy, the purpose. In the world, in nature, because of gravity, all rivers flow into the ocean. Healthcare is a dynamic business. Everything that happens ultimately flows downstream to affect the patient. Old broken racks make getting supplies harder. That keeps the nurse out of the room longer, adds unnecessary stress to the surgeon, adds time to the procedures, keeps the patient under anesthesia longer. Thinking strategically, culturally, tactically, and operationally across the organization allows you to develop a comprehensive plan. The man with the plan wins simply because no one else ever has a plan.